Hello friends, I am Dr. Pritee Sharma, Vascular Endovascular Surgeon and a Diabetic Foot Surgeon at Care Hospital, Banjara Hills. Today I am going to talk about a very common and a very important question which most of my patients ask, and that is pedicure safe in diabetics? There are certain things which I would like to first talk. A diabetic patient will have problem in the arteries, that is blood supply going to his leg might be less than usual. Second is because diabetes causes nerve damage. Nerves are those which carry sensation that I'm pinching or I'm touching. So they have something what we call as diabetic neuropathy. So a diabetic patient will have arteriopathy and neuropathy. Till the time there is no cut, there is no breach in the skin continuity, everything is fine. But moment there is a cut or a breach in the skin continuity, there is mismatch in blood supply and demand. So what is important is any diabetic who is undergoing a pedicure should make sure that they are not shaving their legs before any procedure, because of the shaving there might be very small cuts on the skin, and after a pedicure or during the pedicure, if anything hard is used to scrub the skin or scrub the foot or scrub the nails, then that breach or that cut in the skin is like we are opening door for the bacteria and germs to come in. Another thing is, because there will be neuropathy, there will be decreased sensation. So a normal person, when anything is cut or anything is breached, will have pain. That is a protective response to that pain will be, we will withdraw that part or we will say that there is pain, but that doesn't happen in diabetic. So if you are going to a place where there is pedicure happening, first make sure that they are using sterile instruments, because if the instruments are not clean, sterile, or a fresh set is not being used, then with any scrub or any or anything which is done, that will get contamination. So you will get infection. Third most important thing is during the pedicure, when they are cutting the nails of your toes, the nails should be cut straight. They should not undermine at your nail edges. That will cause ingrowing toenails. The cuticle should not be cut. If you soak your feet for a good amount of time, they can just push the cuticle back. Fifth and very important thing is, make sure that whichever place you go is a trusted place. Don't go to small areas or quacks. Because of the neuropathy and decreased blood supply, you are more prone to form ulcers, more prone to form wound, and by the time it is picked up, it is late and you might end up losing the foot or losing the leg. After the pedicure, make sure to inspect your leg or foot properly. If you find any area which is warm, which is red in color, or which is black in color, or you feel that that is painful, please consult your nearest physician. Thank you.